presidential major disaster declaration for widespread spring flooding, which is estimated in North Dakota to have caused more than $40 million in damage to roads and other public infrastructure. This request follows the executive order I issued on April 24th, declaring a statewide flood emergency. This covers the period from March 2nd to April 25th, when the Red River, at April 25th is when the Red River finally dropped below flood stages in Pembina. It includes 21 counties: Barnes, Cass, Dickey, Emmons, Foster, Grand Forks, Kidder, Lemoore, Logan, McIntosh, Nelson, Pembina, Ransom, Richland, Sargent, Sheridan, Steele, Stutzman, Trail, Walsh, and Wells. And river and overland flooding this spring caused significant damage to roads, bridges, culverts in North Dakota counties that were already heavily burdened by the recovery cost from the spring and fall flooding, the record fall flooding last fall. We certainly appreciate the Trump administration considering our request, which was again a 7-page letter which we signed earlier today. We're grateful for everyone at the Department of Emergency Services that worked to compile data to make the case for federal assistance, and thankful to all of those people at the county level and the local level who also submitted all of this information to help us make a strong request. So thank you to all those affected counties. If granted, this declaration would unlock additional FEMA public assistance dollars to help cities, counties, and townships pay for the costs of repairing roads and other infrastructure damaged by flooding. I also want to thank a number of legislators who live and work in those areas who've also been championing this disaster declaration request, and they've also been personally sending me photos of damaged roads at the township and the county level. And again, really appreciate the hands on the ground from some of our legislators who also are farmers and using those roads. So again, our citizen legislature, thanks for the collaboration there. Preliminary assessments indicate that the damage in the 21 counties is expected to exceed $9.2 million. Additional $2 million of damage still is underwater. The North Dakota Department of Transportation also reported damages totaling $29.7 million to its network of federal aid system roads. And as a reminder, President Trump and FEMA granted our request for a presidential disaster declaration last June in response to 2019 flooding in 19 North Dakota counties. So this is the second year in a row that we've been submitting a spring presidential flooding declaration, and we hope for the same positive outcome. The next topic is behavioral health. And the topic today on behavioral health has to do with grief and loss. And we know that this weekend, when we're honoring not only those that have given their lives for our country, we're now for the first time ever with the Flags at Half Staff honoring the 94,000 individuals who have died nationwide. And of course, we also honor those 52 North Dakotans who have died well infected with COVID-19. The act of saying goodbye to a loved one often begins well before the funeral or the burial, and for many people the days and hours at the end of a loved one's life are especially tender and memorable and poignant. With the isolation measures that are in place in most facilities, we know that people are missing out on these important final farewells. This is true when people die from with COVID-19, but we also know that when people die suddenly, whether it's in a car accident, a heart attack, or other more rapid causes of death, that sometimes family miss out on this opportunity to, quote, say their goodbyes. Well, critical to slowing the spread of the disease, the isolation and physical distancing measures that we're going through right now can make it hard for mourners to come together and grieve. And we know in some cultures in our state, you know, one of the biggest things that happens at funerals is all the hugging and the in-person embraces that go on, the sharing of food and gathering in close spaces, sometimes in homes. And again, this has been a challenge culturally. We know that a number of people have been postponing memorial events, people that have been doing that and pushing or putting things out to the future where perhaps they can gather in a more traditional sense. But if this delay sometimes is causing people to maybe experience more increased sense of loss. And one of the time-tested ways of coping with loss and grief, of course, is social connection. And we know that that's being challenged right now. That's why today we're talking about it on the behavioralhealth.nd.gov website. There's information about grief and loss, 10 ways to support someone grieving during this emergency. It's got ideas about virtual memorials, candle lighting, storytelling events, offering emotional support, and how to access professional services. And we know that in lieu of traditional funeral gatherings, we know that families have gathered on Zoom or Teams calls and done things virtually. We know that people have created other forms of memories that they've built for their loved ones. But as I know, as all these people do from personal experience, losing a loved one, regardless of age or circumstance, is always painful. In a time when caring and protecting one another has to also mean keeping our distance, we know that this can be really difficult. So this is physical distance is an obstacle today. We still have ways to be there for each other socially and emotionally. And again, look for those ideas at behavioralhealth.nd.gov. On a North Dakota Smart reminder, we've talked about the importance of individual responsibility. We are taking steps towards increasing the amount of transmissible moments back in our economy. And we know that Memorial Day weekend is considered by many to be the first weekend of summer. And we know that many North Dakotans are looking forward to getting outdoors, whether it's to be going to the lake, take a camping trip, get on your bike or your motorcycle, fire up the grill, get with friends, get on the boat, go fishing. We know that this is what this means for a lot of people. We know that a lot of high school graduations have been completed. And we also know that for some folks in North Dakota that this is also a weekend of religious celebrations. We know that for others they're going to be celebrating the memories of loved ones. And we also know that across the state on Monday is a traditional day, the holiday of Memorial Day, to honor those individuals who've given their lives in the service to our country as part of their service in the military. And so no matter what your plans are this weekend, we remind people that continue to be North Dakota Smart, follow the CDC recommendations on social distancing and personal hygiene. We are excited to be getting back outdoors and getting back together, but we also know that we'd like to not be 10 days into June and seeing our numbers climb as a reflection of all the interaction that happened over Memorial Day weekend. I'm guessing that may happen somewhere in the country. Let's not have it be here in North Dakota. And again, this may mean that each of you have got to find new ways or an opportunity to create new traditions versus the old ones that you've had. And again, it's everybody's responsibility to protect yourself, your family, your neighbors, and working together. And again, as I said earlier, if you see people that are out and about this weekend wearing a mask, give them your support and encouragement because they may have a vulnerable person in their family. Next topic is around a couple things related to NDDOT. And the first one, of course, has to do with Vision Zero. Memorial Day weekend is traditionally a big weekend for travel, and I'm sure this may be one of the biggest ones this weekend because people have had time where they probably weren't putting many miles on their vehicles. We know that gasoline sales in the United States dropped to the levels of the 1960s, and people are getting ready to get going. We may see that we've got visitors coming from other states to North Dakota because we're more open than and remained more open throughout the pandemic and are more open now than even some of our neighboring states. So we could see a lot of travel. We again ask people as they're here and on the road this weekend to drive safely, observe the speed limits, and of course don't drive impaired, whether that's drugs, alcohol, or dealing with your device or smartphone. No texting and driving. Texting and driving produces activity and results that are equivalent to being the same as drunk driving. And so again, let's be smart. If you're traveling together, together. If a driver is trying to text and drive, just offer to either drive or offer to, hey, I'll do that text for you. Simple things that we can do. And of course, one way to save lives is wear your seatbelt. In the fatalities in North Dakota, still the majority of the deaths that happen in North Dakota can be related to two things: impaired driving, typically alcohol, and not wearing a seatbelt. Those things are things that are alcohol and drug-related crashes, 100% preventable. If you're impaired, don't drive. And many lives would be saved each year if drivers made the choice to drive sober or designate a sober driver or use a ride-hailing service like Uber or Lyft. Excessive speed can also be a factor. We did see during the COVID-19 timeframe that speeds went up on North Dakota. Traffic went down, but speeds went up. We want to remind people, with more people on the road, again, pay close attention. The Highway Patrol, North Dakota's finest, who's been out working hard through this whole thing, will have increased patrols out over this holiday weekend, as they often do, and law enforcement will be stepping up on June 1 the Drive Sober or Get Pulled Over campaign to combat underage drinking and driving under the influence. We know that from motor vehicle crashes, again, are on the downslope in North Dakota because of the limited number of driving earlier in the year. We're actually have off to a unfortunate. It's unfortunate even when you've got the deaths that we have, because even one death is too many in North Dakota. So again, our condolences go out to those families who've lost 23 individuals on the roads so far this year. We like the trend line going down. The whole point of Vision Zero is that some days in North Dakota, nobody dies on the road. Sometimes for 2 days in a row, nobody dies on the road. Sometimes for almost a week, nobody dies on the road in North Dakota. We'd like this year to see if we can go a month without anybody dying on the road, then see if it can be 2 months. Then maybe we can do 3 months. And then at some point in the future, again, whether it's practices, individual responsibility, or improved road conditions, roundabouts are saving lives as we get rid of intersections across North Dakota. So we're investing in infrastructure to save lives. But wouldn't it be amazing if we were the first state some point in the future where we went a year with 0 traffic deaths? And if you say that's impossible, then think about it. If it was your son or daughter or relative that died, then ask what the goal would be, because anything other than 0 is a goal that should be unacceptable to any of us who may know someone who's died in a car accident. So with that, good job so far this year, but let's keep the trend going. Let's have a Vision Zero Memorial Day weekend from a traffic standpoint. When we take a look at summer construction, which again, we're excited about this from an economic standpoint, but our NDDOT is going to be very busy. There's about $400 million of projects that are slated for this year. Those are already getting going. When you encounter work zones, put the phone down and slow down. In 2019, tragically, we had 2 work zone crash deaths on our highway. Our hope is that motorists can take necessary precautions when in work zone to make our work zone Vision Zero and make that 0 for 2020. And again, it's not only for your life and those with you, but certainly for all of the people that work construction for the state of North Dakota. Think about them and their families and slow down. And another last note, this is summer weather. We got more motorcycles on the road this weekend. Be alert, pay attention. Motorcycles, they have all of the same right-of-way rules that you do as a car, so give them room, and make sure that you, as they say, make sure you're seeing motorcycles. And just as we all have a responsibility to North Dakota smart and slow down, we also got a responsibility to keep our roads safe with responsible driving practices. And again, Vision Zero, 0 fatalities, and also 0 excuses. So thank you and have a great weekend on the road. When we move into the good news piece, we've also had questions about parks and historical sites, and I want to share some more news about opening up and how you can enjoy our beautiful state this weekend. If you're heading out to one of our North Dakota state parks, you'll find that comfort stations, concessions buildings, and administration offices are now open for limited services. If you plan to visit one of our state parks this weekend, we encourage you to take advantage of online services, purchase your daily and annual permits online before visiting to limit face-to-face interactions. You can skip having to go into the administration offices. Just go ahead and buy those things, and you can make reservations for camping spots online as well. We're also excited to announce that Lewis and Clark Interpretive Center in Washburn is once again open to the public. You can visit and learn more about North Dakota's earliest the early explorations of Lewis and Clark, and as well as the tribes that helped them through that historic time. And again, residents. They're open between 10 a.m. and 5 p.m. and they're open Tuesday through Sunday. So again, that seems to me, it looks like they might be closed on the holiday Memorial Day, but it looks like they're going to be open this weekend. And may have been noted before, when Lewis and Clark came up, they camped and were supported by the Mandan, Hidatsa, and Arikara Indians through that winter, and the entire group stayed 144 days. That is still the record. The longest time any tourist group has stayed in North Dakota was in the winter of 1804. So if somebody wants to challenge that this year, this is the time to do it. But again, for more information about services and access at our state parks, visit theparkrec.nd.gov. International Peace Garden, partially open today, U.S. visitors. The border, of course, is still got restrictions between here and Canada, but at this time, the grounds, the hiking trails, the campgrounds are open. Restroom facilities are open. Some buildings remain closed, but the Peace Garden is home to miles of hiking trails, scenic drives, historic monuments, lakes and wetlands that are all teeming with wildlife. For more information, visit peacegarden.com. If you have not been to the North Dakota Peace Garden, this might be a good weekend to drive up there. If you haven't been to one of our 13 state parks, it might be a good time to visit them. And we have across the state many incredible State Historical Society locations, and most of those state historical sites will begin opening again tomorrow. And we, in keeping with North Dakota Smart Restart policies, sites will operate at reduced capacity to allow proper social distancing. Site tours may be limited. Touchable exhibits may remain closed. And then a couple exceptions here, the Ronald Reagan Minuteman Missile State Historic Site near Cooperstown. If you haven't been there, try to get there this summer. You can actually go down in a missile site, and it's frozen in time. It's as they left it when they decommissioned it. So pretty amazing, down to the Life and Look magazines laying on in the rec room. The Heritage Center and the State Museum in Bismarck will remain closed at this time. There are a number of unstaffed historic sites, including Double Ditch Indian Village, Huff Indian Village, Minokan Indian Village, Fort Clark, Fort Rice, and Whitestone Hill. They will continue to offer free outdoor opportunities to explore trails and historic landmarks. For more information about state historic site opening services and hours, visit the history.nd.gov. And as we close, and again, I should say on that one, we got this great slogan this year that was pre-COVID. North Dakota tourism slogan this year was "Follow your curiosity, not the crowds." And of course, curiosity is one of the things that drives happiness. Stay curious like a child. Stay curious like your new puppy, and get a chance to get out there and learn across the Parks and Rec, the Peace Garden, and North Dakota history sites. Follow your curiosity, not the crowds. You would have thought we made that knowing that COVID was coming, but again, practice that this weekend. On the gratitude side, want to also say we've got so much to be grateful for when we think about those brave men and women who have given their lives for our country. And as we get ready to enjoy this long holiday weekend, we want to take a moment right here to recognize all of those who not only served but died while serving in the military, and who we will remember and honor on Memorial Day. As a nation and as a state and as individuals, we owe our deepest gratitude to the heroes among us who stepped forward to defend our rights and freedoms as Americans. And we cannot ever take for granted those who have made the ultimate sacrifice. This weekend and on Monday, we encourage you to take some time and remember and honor those brave souls whose sacrifices need to be remembered and honored each year, and those who have helped us secure our rights as Americans. A number of traditional Memorial Day services have been changed to virtual or televised. And so again, if you in the past weren't able to attend because you weren't for whatever reason able to get to one of these physically, maybe we'll have even higher attendance this year than ever. But the annual Memorial Day ceremony at the North Dakota Veterans Cemetery is going to be a small group out there, including myself and other officials, and that'll be live streamed, and we invite you to join online at 12 p.m. Central Time at ndguard.nd.gov, and that's on Monday. That'll be live streamed, a live event, live streamed from Memorial Day ceremony. It also may be carried, I think, on some television television channels. A virtual ceremony is going to be held at the VA Fargo National Cemetery beginning at 2 p.m. on Monday, and you can attend that online by going to facebook.com/Fargo National Cemetery Committee. We know that across North Dakota there are many more communities and organizations finding North Dakota smart ways to honor our heroes on Memorial Day, and we encourage all North Dakotans to join in sharing our gratitude for the military members, and especially those who have made the ultimate sacrifice. And in concluding, let me share a quote from Admiral Forrest Sherman, the admiral who served both in World War I and in World War II. And on Memorial Day some time ago he said, "Today let us as Americans honor the American fighting men and women, for it is they, the soldier, the sailor, the airman, and the Marine, who have fought to preserve freedom. It is their valor that has given renewed hope to the free world, that by working together and in discipline and faith, our ideals of freedom will always prevail." Again, Admiral Forrest P. Sherman. So tune in, noon, nd.guard.nd.gov for the annual memorial ceremony from North Dakota Veterans Center, and 2 p.m. On facebook.com, Fargo National Cemetery Committee for the VA Fargo National virtual meeting. And then for us, we'll be back here Tuesday at 3:30. And again, for those that sign off before we go to Q&A, thank you for your time and presence today. And until then, enjoy the holiday weekend, and remember to be North Dakota smart as you celebrate Memorial Weekend this weekend. Drive safe, be healthy, and now we'll stand for questions. We're going with Amy first, then we're going online, then back to you, Jacob.
Do you have any sort of a tally of violations that were issued when those restrictions were in place on restaurants and salons and businesses like that?
Answer to that one is no. Those would have.
I mean, I know in general, I think many businesses were in compliance. I know there were some that I've just heard about.
Yeah, if you heard about them, I probably heard about them. They were, might have shown up in a local paper. It would have been a local action that would have done it, but that was not data we were tallying here. I mean, I think by and large, felt we had as a state really high compliance around all of those guidelines and procedures, and we look forward to seeing that continue going forward. Online?
Mike Smith, 660 KUYZ in Williston. A few weeks ago, some legislators requested more transparency on the models you were basing your decisions on. Now your political opponent is filing a public records request. Do you feel that your administration has been transparent delivering data to the people?
Yes. I suppose I could elaborate. I'm smiling, of course, because we got people in this room that this is what your first 52nd press conference. In addition to the press briefings that we've done, I've lost count of the number of briefings we've had, the amount of information that we've got published on ND Response, the North Dakota Health website, the North Dakota Commerce website. There's enormous information, and we have been working diligently. We get dozens, perhaps hundreds of FOIA requests for information throughout this thing, and in our small little team that we have in the governor's office, if they come into us, then we've got no other resources. We're working to try to fulfill all of those requests, and I would say that some of them that have come in, if it was paper versus electronic, it would take pickup loads. You'd be filling up the back of pickup loads with paper on some of these requests, because some of the requests are so broad. It's sort of like basically tell us everything about everything that's happened since the beginning of the time that this began, and we'll work to fulfill those. It's our duty to try to fill those requirements, but they're not necessarily easy, and sometimes they're so broad they're not very specific, and so that's it takes time and effort. We'll do it. We are all in on transparency, and again, even as I read some of the requests that have come in, I know that things that they're requesting is stuff that we have already shared publicly, so it's a little interesting to get a freedom of information request for stuff that's been shared over and over and over and over again. So we'll just keep working through it and make sure that all the data is public and transparent. Going forward, we're happy to do that. That's our job. We operate in the open and in the light, and I think that if people want to understand about how decisions get made, I think that one good way to do that would be to watch the tapes of all of these briefings, because we have all of your questions and all of the decision making and the thought behind it and the modeling and the data ultimately right here in relative to the state, it's my responsibility, and I've tried to, as best I can, expose all of my thought processes to the whole state, as scary as that might be for some people, but we're putting it all out there and happy to keep doing that. Jacob?
Governor, in reference to the COVID-19 story, you've said this entire time that third parties aren't buying the data and whatnot. But at the same time, in the privacy policy for the COVID-19 app, it says that the data won't be shared with anyone, including government entities or third parties. But in the same privacy policy, it lists a few companies that say they are using that data. At the very least, is this not an inconsistency in messaging?
Well, I think there's been a slight revision to the privacy policy to try to tighten that up to make sure there is no inconsistency, but I think that... What's that?
This was about an hour before the press.
Well, hopefully you got the current one on there. Thank you for that. But the word sharing the data, because sharing the data implies that somehow the app is sharing personal data when there's no personal data on the app. And so then it's really the data from Foursquare is coming to the app because it's the name of that local, say again, coffee shop. Pick your local coffee shop, you go there, and then Foursquare will say, okay, they were at this local coffee shop. They send that data one way. The data's not going the other way. And so there's not sharing going on of any personal data, because it doesn't exist, and what Foursquare is providing a free service that they provide, again, through their software developer kit to any developer that says, if you want to get the name of the business that you're standing next to, we'll send it to you for free. And if they had a ID, a 32 random ID number from the phone that identified the phone, then Foursquare discards that as part of their privacy policy. They don't keep it, they don't use it, they don't market to it. And so we'll make sure that that's super consistent, but there's nothing, the way I think about personal data, there's no data being shared. It's not being collected by the app, and if you don't collect it, you can't share it. So, in
all fairness, it doesn't say personal data specifically, it just says data.
Yeah, well, data is pretty broad, and would be data related to somebody's phone, we don't know who it is here. That would be also considered data. So there's somebody's phone was at the coffee shop for 10 minutes, and now we're going to say this is the name of our coffee shop. We're going to send it to that group. We send them the name of the coffee shop. So they're the ones that are sharing data that's actually usable, like the location and name of a business, but there's nothing about the individual that exists to be shared with anybody else. So that's the part that's but again, any other, you go shopping online, you go shop online, that data is, bought, sold, used by all kinds of people. COVID-19 is not in that business and doesn't profit from it. So I love the deep scrutiny, and I love the fact that maybe people are getting educated about how these free business models work. But I tell you, there's nothing there on this COVID-19 story, because there's I mean. I'll just stop there. I was gonna, because I'm impressed by how cost efficiently this has been developed by the state of North Dakota versus other states that are spending millions of dollars on apps. And we've got one that is completely private and it's free to the user and nearly free to the state of North Dakota. So good spot to be in my mind. I'm going lane, then we're going online.
Governor, with the high numbers lately, I know you guys have said you've expected that with the targeted testing, but you've also said that we're kind of lagging behind the rest of the country in numbers, and was wondering if you thought it's possible that we might be actually hitting our peak now instead of previous.
I think the key thing to keep looking at is the percentages, not the raw numbers. I mean, if we have, 90 positives today out of what was close to 2,300, 2,400 tests, 3.6% I think was or 3.5% was the percent today. As long as we're in those low single-digit percentages, then and we are being very targeted. As I said before, in those early days when we were hitting 2,000 tests, we were getting some of those. 1,000 of those people were the worried well coming to a drive-through event, and we were getting almost no positives out of that. If we're contacting people who live with or work with people who are positive and saying, please get tested, and in a targeted fashion. If we're going into long-term care centers and testing everybody, where there's, that's a potential high area of prevalence, and we've only getting 3.6% of the people coming back positive, you got to feel great about that, because I feel good about our numbers in percentage-wise. I also feel good that we're, per capita matters. I mean, we're doing testing, only one state, Rhode Island, home of CVS, is doing more testing per capita. Only one state has tested a higher percent of the population, and we're doing that in a more targeted way, because some of the numbers in other states may be driven up also by drive-through testing, where we know that we're kind of past that phase and we're doing the targeted. So highly targeted, low percentage, great spot. You want to focus on Cass County, because that's just, that's one spot. If you got 82% of the positives coming from one county, we've got to keep driving resources there, and we are. And again, statewide, you saw in the numbers yesterday or on Wednesday where we had cases pop up like in Glen Ullin and New Salem and in Mayville, in long-term care facilities where you get 10 to 20 positives that show up between staff and residents in long-term care. That's why our whole focus with Chris Jones and the most vulnerable population, statewide, about 20% cumulative of all the positives have been in long-term care, 80% outside of. But that's that in long-term care. A month ago, only about 10% of the positives were in long-term care. Now it's 20%. It's 20% probably because we're doing targeted testing in long-term care. We're really getting in there and really understanding that. And within long-term care, the split is about 11% plus. You're getting 11 to 12% staff and 8 to 9% residents. And so again, when we have that information, it helps us really focus on how do we keep staff safe, the healthcare workers that work in long-term care. So I like the numbers. I like the direction. I like where we're going. The only one I don't like is I'd like to see Cass County start figuring out a way when we can start turning the corner there and getting that number lower. But if we find the positives and those people are isolating, that's the way we're going to slow the spread. I want to thank everybody, the mayors, the county, the local Cass Public Health. Those guys have been working very hard the last 2 weeks, and we're getting great collaboration from employers, where if employers find that they've got 1 or 2 positives, they're inviting us in, particularly in manufacturing, to test everybody that works there. And this is a reason why I think with that kind of collaboration, why we've not been reporting any large outbreaks at a manufacturing plant so far in Cass County, because of the responsiveness of employers wanting to take care of their workforce. So good progress, good collaboration. We'll increase the focus, increase the effort, and again, I want to thank the testing teams that made it all the way around the first thing through all the 218 long-term care facilities. We'll be back again. We've got to go back through all those long-term care facilities again, and staff again. It's not a one and done. It's a keep going back, and we want to keep going until we know that we get zeros in those long-term care facilities, because that's the path to reopening. And we know that there's a lot of pressure to let's get visitation going in long-term care. And we want to make sure that we've got the ability to do great testing. That could even mean weekly testing at long-term care as part of that reopening plan. But thanks for your question, as always. Dave, that was a very subtle. It was like a high-end Sotheby's auction kind of hand raising there. I think that's right.
In an earlier briefing, you talked about trying to do more public-private partnerships with labs. Have you had any action on that? Have you had any positive response to that?
Well, I would say from the healthcare system, Sanford has played a role with their Sioux Falls lab, with a percentage of tests every day going there. Essentia, when I talked to Dr. Bill Heegard, who runs the West Division of Essentia earlier this week, they're ramping up some of their capability. And so in addition to what they might be doing on point of care, they've got a lab in Duluth that they're sending some facilities to. All True in Grand Forks has had a long partnership with Mayo. And so some of the Grand Forks testing earlier on was going to Mayo. Now that the Grand Forks numbers have dropped. Some of the testing numbers have dropped. So those would be on the private side. The state of North Dakota is working with one national lab, and we're doing a test to send some samples there to see if we can be guaranteed a 48-hour turnaround in terms of results. We could have more information on that next week if that works. And then also, there's a terrific biotech company in North Dakota, Aldebaran, which is in the biotech space, and they've got some of the biggest, most beautiful labs in the state, and they're working with people all over the world that are working on vaccines for this and other infectious diseases. And so we're going to be having a meeting with Aldebaran next Tuesday, and we'll try to keep discussions there. I think there's opportunities with the universities. That's more public than public-private, but we've identified that there may be some underutilized lab space at UND or at the medical school or at NDSU pharmacy public health that could be tasked. So we want to come up with a long-term strategy where we're, right now 80% plus some days of the tests are being done at the North Dakota State Lab here in Bismarck, and we've brought in two mobile lab trailers that are set up outside, so we've run out of physical space. We've got these, they're designed, think of them as sort of semi-trailer labs that come in, and they get rolled off. There's not wheels underneath them, so they're mobile, and that when they're done with them after a period of time, they could be moved. That's not a great long-term solution, and I think, again, a vision where we might have more distributed labs, tighter connections with higher education, and some of the capacity going to the private sector would make sense. Because again, when we're going, we don't want to end up 2 years from now with a lab in Bismarck that can do 20,000 tests a day, and then we don't have demand for that. It would be better risk management for the state to have this be distributed, and if some of that investment goes into higher education, it could have long-term uses for research. So we're being thoughtful about how we scale capacity, but in the meantime, we're still in an emergency, and we've got to keep driving it up. And you've seen that we're trying to get to 4,000 tests a day. We're not there yet, and so we got more work that we have to keep doing to hit the goals that we'd set earlier. Okay, I'm going Jacob, then online.
Governor, back to CARE 19, while your position has been one that you seem to be fully aware of the situation at the time, at least Vern Dosh, your contact tracing liaison, told the Washington Post that they should have vetted the app. Which is it? Should the app have been more vetted, or has the state been fully aware of this the entire time?
Well, I'm not sure exactly about that. If that was having been interviewed by the Washington Post before, I'm sure Vern said things before and after that quote that was parsed out, so I can't take the full context of his answer. But I would say if there's a key responsibility here that could have been done is that we could have done a better job of updating the specificity in the privacy policy that explained how data was coming one way from Foursquare to the app, and then there was also a couple other diagnostic tools that were being used by ProudCrowd, again, not using anybody's personal data, but they were using that, and we make sure that we got those disclosures, and we've got those, I think, fixed in the privacy piece, but there's the intentions were always clear, and the design was always solid, and no personal privacy. There's no breach. There's no possibility of a breach because there's no personal data there. So I keep getting curious about why. Again, you can tell I'm partially amused by the interest in this, and I can't even speculate why it would be, but it's when there is entire industries built around using and selling people's personal data for advertising purposes, and that is not the design, the intent, or the capability. It would be impossible the way the app is designed to actually do that, because there's no phone number, there's no address, there's no email, there's no registration, there's no nothing in there. And so so that's the and again, the gotcha in this case came from a company that is in the business of trying to scare people about you need more privacy, so buy our thing, so you'll be more private. So there is actually an economic motivation for this group to do what they're doing, but that's the world out there in the big competitive world. I lived in it a long time. I understand it. I'm right now I'm amused by it. Okay. We're going Amy and then online.
Okay. I have just a quick two-part question about the Capitol reopening on June 1st. When employees and when the public comes in, will they be going through the same sort of like temperature check and screening question process that we go through when we enter the Capitol?
Yes.
And then I'm just envisioning, 8 a.m. or 9 a.m. whenever, workers show up here, like a lot of people filing in at once. And are there going to be efforts to like have multiple stations set up where they could go or keep people spread apart so they're not all lined up right next to each other? What's that going to look like?
I'm certain that the people working on the continuity of government have thought that through. And the other thing, of course, we would I'm sure that group that's working on this, specifically as it relates to the Capitol, would be encouraging people to have staggered start times to avoid that kind of crush of coming through. And good reminder, if we haven't, we'll make sure we do, because there's no reason, again, that we shouldn't be trying to space that out. And again, we anticipate it when we start out, it's going to be 50% or less capacity, because a lot of people have adopted to working remotely in a really highly productive way, and some of that is certainly going to continue going forward.
Okay, and then the temperature check that I think we've all gone through, is that an infrared process, or do you know? I haven't been participated in the media temperature check policy or practice, but are they putting a little thing on your forehead? Is that what they're doing? No, you stand out in the hallway and you open your mouth, and about 6 feet away there's a little device that takes your temperature somehow.
Okay. Okay, all right, good. That'd be good. I'm assuming infrared seems like a good guess, and I don't think it's ultrasonic. I don't think it's that. I think infrared would be more on the heat thing, but we'll, lots of different ways to detect things. Okay, we're going online.
Scott Hennon, WZFG KFYR Radio. Of today's 90 positives, do we know how many were from contact tracing or focused testing versus those who presented with symptoms at a clinic or hospital? And is that number going to be provided?
Scott, somebody knows that number. I don't have that right here in my briefing, and that's not one that we have. Not one that we have released in the past, but we'll take a look at that, because again, we're trying to always get more granular with the data release. We think that as long as we can protect personal privacy, that would be one I think we could share without affecting any HIPAA laws. So that would be one for us to look at. And I think we are sharing. I believe are we sharing the data around number of cases that are in long-term care? That's out there. And so you could net those out, because those, I wouldn't call those, for Scott, I wouldn't call those contact tracing. I would call those targeted testing. But when we go in and test a facility and then we find a pocket of those like we did a couple of days ago, then that bumps up our numbers for the day. But we disclose all those that are both long-term care residents and long-term care staff. Okay, I'm getting a signal. I either got the victory sign, or it's from Mike, or it's 2 questions remaining. But how many do you have left online?
3.
Okay, so we're going to do 4 more. We'll do the 3 online, and then Dave.
Jean Schemp, Hometown Radio Group. There were 26 positive cases uncovered at this week's mass testing event in Minot. 100% of those were asymptomatic. Do you know if the rate of asymptomatic positive cases is increasing, and might those be false positives?
I don't know if they're false positives. I do not believe they're increasing, but we could check on that. And from other data that I'd seen, we were, again, could vary by age group, but we're seeing, some cases it's not, it'd be unusual in that case to have 100% of them be asymptomatic, but we've had other batches where, 30% and 30 to 40% come back sometimes asymptomatic. And so that's, one of the challenges in trying to track this thing down is people have it and maybe spreading it and don't know they have it. So again, that's what contact tracing tracing can lead us to people who have been exposed to people that we are known positives and may be symptomatic, and then we get to someone who is asymptomatic and maybe they're going to become symptomatic, but we catch it early. It's always fantastic when we catch somebody who's asymptomatic, because that's one way we're probably really slowing the spread. But good data questions, Gene. My team's writing these all down, and we'll keep digging. Love the curiosity. Okay, next question.
Tom Simon, Williston Trending Topics. The drive-through testing event in Williston yesterday had just 189 participants. Do you have any ideas as to why there was such a small turnout, and is this a good or bad sign?
I don't know what the goal was, Tom, so I won't try to characterize where it was good or bad turnout. 189 testing through an event like that is, solid sample. And again, anybody can get tested in Williston or any place else, all the places around the states. You don't have to wait through drive-through testing. If you feel even over this weekend, call your provider. If you're feeling symptoms or if you've been exposed to someone who's positive and you're concerned about it, call your provider and go get tested. Lots and lots of test kits all over the state. But when we can, come in and coordinate with a local community public health like that and pick up another close to a couple hundred tests, that's a good thing. And so again, just say thanks to everybody in Williston for participating in that. The question on why there may be lower turnout, I mean, Williams County has been fairly low on number of positive cases, and I'm not even sure if there's been a death up there. And so if you've got I think we see more demand for testing if people feel they're surrounded by the virus, or if they know people who've passed with COVID-19, they've probably got greater awareness. We know in states where there have been a lot of people that have passed away, there's higher inbound demand for people getting tested. I think that's just a natural psychological thing, where here we might feel like, if it hasn't been here, why should I go even if I'm not feeling well? So maybe we've got less demand. But again, encouraging people to go get tested if you need to. Okay, there's one more.
April Baumgarten with the Forum of Fargo-Moorhead. I know you were trying to promote personal choice, though I can see the emotion in your call to avoid the mask, no mask divide. You've been very calm during this time. Could you speak to kind of the emotion behind your words while talking on the subject?
Well, I just think it's important. We hear a lot of voices in the governor's office from and we get lots of input from lots of different people, and as we sift through all that input, sometimes there's some really touching stories from individuals, and I think that in our state, again, we've got a general view that this is something that is it hits old people, which it does, older people and people with underlying health conditions, and we forget that there are, children in our state and in our school system that may have gone through, tragedy of childhood cancer. They may have other underlying issues. You could have, someone who's got cystic fibrosis, which until recently, if you had that disease, the life expectancy was about age 30. If you're someone that got dealt the wrong card, either through a genetic disease like cystic fibrosis or some unexplainable cancer, then COVID-19's not a joke. It's not something that should be laughed off. It's not something like, oh, they're taken too seriously. To those individuals, this is a matter of life and death, and because it is, again, it can be really horrible, tragic and deadly disease for people that are that have those underlying conditions. So again, I just think that when we see people with a mask, the first thing that somebody ought to assume is that they're doing it because they've got people in their life that they love and that they're trying to take care of. And I just think let's just start there, and then drop the judgment. In North Dakota, we find our better selves, I guess is what I would say, and think about that, because some people may be out in public, they may be out shopping, they could be shopping for an elderly couple that's a neighbor, doesn't have to be a family member, but let's just start with empathy and stop with the mass shaming. Okay, Dave.
Just a real quick question: why not the Heritage Center being open?
I think we'll see the Heritage Center opening coming soon. You're going to see that. I think we just want to make sure that we've got the staffing and the protocols and all of that right, and but there's no reason why we can't get that back open again. Does that wrap it up? Okay, again, so thank you for being here on a Friday afternoon. If those of you that are tuning in, thank you for staying with us the whole time, and also be safe, drive safe, be safe, and be sure to remember those that gave the ultimate sacrifice. Take time on Monday, even if you don't attend an event, maybe with your family, teach your kids what the real meaning of Memorial Day is, and take a moment of silence and think about those folks that served our country and fought for the liberties and freedom that we're still fighting for every day. The fight for freedom never ends, and it's alive and well here in North Dakota. Thank you all.